आपके साथ एक वेरी इंपॉर्टेंट टॉपिक डिस्कस करने जा रही हूँ. वो है विटामिन्स इन प्रेगनेंसी. So basically, we require vitamins, minerals, and micronutrients throughout our life. But when there is a pregnancy, there is increased requirement of that, as we have one baby to share our nutrients with that baby. So during pregnancy, whatever vitamins we require normally for our body, we require more than that, and so we have to be aware regarding those vitamins and minerals, and we have to take care of ourselves and also our child. So basically, taking prenatal vitamins also is very important, and with the proper constitution, we have to ask our doctors what are the requirements and how we should start. When certain patients who have diabetes or patients who are taking anti-epileptic drugs, those people, when they are pregnant, they require certain vitamins in more amount than normal. The most important vitamin which is required in the pregnancy is folic acid. So doctors ask them to take this vitamin even prior to conception. So this vitamin is a part of B complex vitamin, and it is very important for the development of cells and other parts of the body, and it is extremely important for the patients which are told diabetes and patient taking anti-epileptics, and prenatally and next 3 4 months also of pregnancy we have to continue this vitamin in a very particular way as doctor suggests. The second very important vitamin nowadays is vitamin D. So nowadays we do vitamin D3 levels, and if it is less, then doctors prescribe certain uh, like medications to take so that our body vitamin D3 becomes important. Vitamin D3 is important for absorption of calcium also. So sometimes during pregnancy, when we take calcium along with it, we have vitamin D3 also along with that calcium. Also, certain times we need vitamin B12. So B12 deficiency also is increasing many folds everywhere, and we do vitamin B12 levels, and when they are less, we have to do vitamin. We have to take vitamin B12 injections also for our body. Then there's vitamin C also, which is important. Vitamin C is present in lemon, in orange fruits, and that vitamin is very important during pregnancy. Vitamin A also is very important, and which is present yellow colored fruits, and that vitamin we usually take in pregnancy. So our body gets all this vitamin from the diet. So if you are the vegetarian person, then certain vitamins are less. Like vitamin B12 is in abundance in non-vegetarian diet, but in vegetarian diet we have to take some supplementations for the vitamin B12. Then folic acid, as I told you, it is a very important vitamin, and that is very essential and crucial for the development of all the cells of the small fetus child when it is growing in our body. Vitamin D helps the body to absorb calcium, and important for the bones and teeth, and also helps your body, nerves, muscles, and immune system to work. So during pregnancy, you need around 600 international units of vitamin D each day. So certain times that content is added to your calcium, and the added calcium and vitamin D3 can be given to the patients. Vitamin B12 is important to keep the blood and the nerve cells healthy, and it also helps to make DNA and genetic material in the body. So, rich sources such as fish, meat, poultry, egg, As I told you, certain vitamins are good in non-vegetarian diet. So few dairy products also, the vitamin B12 is in abundance. So being vegetarian or vegan makes it little difficult to get vitamin B12, and deficiency can include like megaloblastic anemia or fatigue, then palpitations, then weight loss. Certain times infertility also is a part because of the vitamin B12 deficiency, and as well as increased risk of low birth weight and preterm births and recurrent pregnancy losses, and few congenital anomalies too uh, are there because of vitamin B12 deficiency. Vitamin C protects cells and helps to keep them healthy. So it is required for the healthy bones, teeth. It promotes iron absorption. So as iron and calcium as we take. So along with that, you have to take vitamin D3 and vitamin C for the absorption. Then there are rich sources such as orange and orange juice, which we can take. There's agave, amla, red and green pepper, and strawberries and blackberries, and potatoes, which are a rich source of vitamin C. And deficiency is characterized by the weakness, then bleeding gums, and the defective bone growth. Vitamin A is a fat soluble vitamin necessary for the clear vision in dim light and for the maintaining the integrity of the epithelial tissues. So deficiency can lead to the losses of the white conjunctival area has some losses of luster, and it becomes dry, the development of dry eyes, and certain times vitamin A deficiency called blindness in the children. So the rich sources are carotenoids and fruits, vegetables that are green or deep yellow orange in color, and such as green leafy vegetables, carrots, tomatoes, and sweet potatoes, papaya, mango are very important vitamin A sources, and those we have to take during pregnancy. So all these vitamins build we have to build these vitamins in our diet, and we have to be very careful during pregnancy because we don't want our babies to anyways become low birth weight or they have any deficiencies of this vitamin. So we take care very much, and so there is a lot of discussions regarding these vitamins and what is to be taken during pregnancy and how we should go about during pregnancy. But I tell you all, like listeners and this baby chakra who is providing all these discussion groups for everyone, that these are very important topics and we have to really discuss certain things. Certain times I feel even the young women, then even uh, the girls and women who are not pregnant, those also require particular amounts of all these vitamins, and we have to be very careful while taking these vitamins. Have a balanced diet, avoid the diet which is fast diet. You have to be a lot of fats regarding intermittent. There is uh, ketone diet, this diet, that diet, but our own Indian traditional diet is very important, and we have to follow that diet. And even Mediterranean diet, it's kind of concepts where we use more of fruits, more of good proteins, and that diet is also important. Last 10 years, one decade, there's a lot of discussions and lot of papers regarding all these diets, how they influence our body, then how they influence our fertility and good development of the newborns. So we have to discuss all these aspects, understand our diet, and follow it very religiously. And uh, the complete diet is more important rather than fast foods and just following some internet and Google remarks. That's what I feel. So if you have um, any doubts, do ask me. We will solve your question. Yeah, Deepika is asking, is vitamin D required during pregnancy? Yes, vitamin D is very important, and vitamin D is required for the absorption of calcium, and calcium is important for our bone development. So it is very important. Now, Nisha is asking, which vitamin and minerals are most important and why? As I told you, this vitamin B complex, in that folic acid, very important. Vitamin B12 is important. Even vitamin B6 is important. B3 is important. Omega 3 fatty acids we have to be very particular about. Vitamin A is important to avoid the blindness. Vitamin C is important. uh, then we have to take care of all these vitamins. Even the vitamin K, which is required for the clotting, as a important part of the clotting factor, that is also important. And because of that, when the baby like birth of the baby happens, certain centers, we give vitamin K injections to the babies also. uh, Andrea is asking, what should I do if I have morning sickness and I'm throwing up? Morning sickness in the pregnancy, do you want to ask, Andrea? Like, you get nauseatic when you wake up, or like kind of vomiting? Then it is, this pregnancy induced vomiting is a very common thing, and in first 3 months we have this kind of vomiting and morning sickness. Then in these cases we have to be like, in particularly when we wake up, we have to take dry toast. Avoid eating when we uh, eat in the evening hours around 7 and a half, and then take half an hour walk and then sleep. And then if it is like severe and it's causing like disturbance in your daily day-to-day practice, you have to consult doctor and find out if there are any ketone bodies in your urine or any other problems. Pooja is asking, I'm a vegetarian and should be taking any additional supplements. Pooja, I need to know that, have you planning for the pregnancy, or what kind of other deficiencies you have? If you feel that you are a pure vegetarian, first thing is, uh, there might be a chance that there's a vitamin B12 deficiency, and you have to take care of that. You can do vitamin B12 levels and go for the treatment. And vitamin D3 also you have to check, and if they are low, then you have to take the additional supplementations regarding that. And add certain vegetarian diet also, such that you will get the proper all kinds of vitamins. Apurva is asking, is it bad if you don't take your prenatal vitamins during your pregnancy? So, prenatal vitamins in your pregnancy are very important. As I told you, that vitamins are very important factors uh, for your day to day life. And when you are pregnant, your requirement for the vitamins increases, and sometimes it is double. So you cannot avoid uh, this prenatal vitamins altogether and get away with it, because anyways your baby, that fetus, is going to take all your all the requirement from your body, and you will be weak because of that. So to keep your health, you have to take additional supplementations such as vitamins, and like be ready for the all the good things of your pregnancy. So certain times when you feel that these prenatal vitamins and uh, other less calcium iron is like causing a lot of trouble to you, then you consult your doctors. Or you are not sure ki which prenatal vitamins to be taken, you have to consult your doctor and take appropriate doses of vitamins, because we take over the counter, and we cannot take these vitamins as and what like we feel. We have to consult our doctor, and according to our body conditions and according to our uh, like health conditions, our diseases, our in general profile, doctor will decide for you which vitamins are important for you. So thank you, Baby Chakra, and thank you everyone who has given me this platform where I can discuss this very important topic with the audience. And if you have any questions, you can come up with uh, such questions, and we'll be able to answer those questions. And thank you very much for this wonderful afternoon.